Listen-only mode.
Hello, and welcome to TCS Healthcare Technologies webinar focusing on Acuity Complete Care, the hosted version of the powerful care management software Acuity. This is the final webinar in a three-part series. Sessions featuring Acuity Advanced Care version 7.20 and Acuity Connect were conducted in March and April. Please visit the webinar section of tcshealthcare.com for a link to recordings of those web sessions. We are pleased to have two fantastic speakers from the TCS team, Jeff Frater, Director of Partner Development, and Linda Killian, Manager of Client Services Operations. Before we begin the presentation, please be informed that today's webinar is being recorded and the attendee phone lines will be placed on mute throughout the program. You are encouraged to submit questions by using the question feature in the GoToWebinar control panel. At the end of the program, with time permitting, the speakers will address your questions. The TCS team will follow up with any that they do not have time to address via email. Contact information for the TCS team will also be displayed at the end of the presentation. Also, please keep in mind that this is a brief demonstration intended to review some of the high-level features of the Acuity Complete Care platform. For a complete demonstration of the full capabilities of this comprehensive care management software solution, please be sure to ask for follow-up contact. At this time, I'd like to turn the presentation over to Jeff Frater. Jeff?
Thank you, Jessica. And thank you to all who have taken time to attend this session and learn more about our hosted solution, Acuity Complete Care. As Jessica indicated, my name is Jeff Frater, and I'm Director of Partner Development here at TCS. By background, I'm a registered nurse with 20 years of case management experience, and here at TCS, I'm responsible for all sales and marketing activities. I'll ask Linda to introduce herself as well.
Great, thanks, Jeff. Hello, everyone. My name is Linda Killian. I'm the Manager of Client Services Operations with a degree in Business Management and Medical Informatics. I have over 30 years of experience in the IT industry, and I've been with TCS Healthcare now for about 14 and a half years.
Great. Thank you, Linda. Okay, before we get started, let's take a moment to review the topics that will be covered in today's session. So first, Linda will be reviewing some of the information about TCS as a company. I'm going to walk through the Acuity product suite as well as add-ons that accompany Acuity Complete Care. And then Linda and I will demonstrate the Acuity Complete Care software product with Linda driving, and I'll be narrating. Linda's going to briefly address implementation, and then time permitting, we will address questions and answers. Okay. So, Linda, you want to review TCS?
Sure, thanks, Jeff. So we felt it would be important for you to know a little bit about TCS and some of the things that make TCS different from some of the other care management software vendors. First is the fact that TCS is a privately held firm with 32 years of experience in developing care management software solutions. Our founder, Rob Pock, first developed his first utilization management software program after he met a director of for a health plan in Los Angeles who asked for a software program that would help her nurses get authorizations loaded into her claims system. One thing our clients tell us that sets us apart is our culture of service. In fact, many of our clients will refer to TCS as a partner and not merely a vendor. During our time, we have focused exclusively on care management software. You'll see that in the clinical focus and thought in the products that enables Acuity to be such a robust platform in support of care management programs. Finally, we're very proud that during our entire history, we have never had a client fail an implementation. We believe this is a testament to the care we take in identifying clients and supporting their implementation process. Jeff?
Thank you, Linda. So I did want to take a few moments and review for you at a high level the three versions of Acuity that are available. At the top of your screen, you'll see ACUITY Advanced Care. ACUITY Advanced Care is really our flagship product. ACUITY Advanced Care was first released in 2005, so as you might imagine, it is a very seasoned product. ACUITY Advanced Care is an on-premise or installed application, and this is the most robust of all of the ACUITY products. ACUITY is noted for its flexibility and configurability. Some of the features Linda and I will demonstrate today represent custom assessments and triggers that we added to our ACUITY platform for the purpose of today's webinar. Next, you see ACUITY Complete Care. ACUITY Complete Care is the same core software as ACUITY Advanced Care, only in this case we offer it in a hosted environment. Instead of your organization purchasing and maintaining the hardware, allocating the IT and data analyst services for support of the hardware, we at TCS provide that. As you can see, there are restrictions in terms of the volume of users. It is also important to note that due to the hosted nature of ACUITY Complete Care, it does not offer all of the same technical options as ACUITY Advanced Care, but it does feature the same flexible and configurable workflow platform. Now at the bottom of your screen, you see ACUITY Anywhere. This product was developed in collaboration with the Case Management Society of America and is intended for independent case managers with very limited software functionality needs. It has been our experience that organizations with more than 1 or 2 users and needing more than a simple tracking system do not have their needs met with ACUITY Anywhere. But we did want you to be aware of this platform. As with all of the topics discussed today, if you'd like to learn more about any of the platforms or options covered here, please either submit a question via the webinar question feature that Jessica reviewed earlier, or reach out to us after the web demonstration today. Either use my email address that will be presented at the end of the demonstration, or visit our website and complete the Contact Us. Next, you see ACUITY Complete Care in relation to the add-on utilities and options that are available with this platform specifically. In the center of the circle, you see the core care management system, ACUITY Complete Care. But at the top, you'll see the red logo for AccuStrat. AccuStrat is a utility that accompanies ACUITY Complete Care, providing stratification and automation abilities. With AccuStrat, you can apply filters to a data set to identify a population and then automate actions in ACUITY for the users. For example, you can set filters to identify diabetic patients that have not been enrolled in a case management program, and, if it's in the data, that have not had their HbA1c tested in the past year. And then AccuStrat can create automatic tasks in ACUITY Complete Care for the care manager to contact the patient and their PCP to arrange for the test to be completed, thus closing the gap in care. This is a very rudimentary example of the many powerful stratification and automation features that can be set within AccuStrat. Next, you'll notice the red logo for AccuPort. As you see on the screen, AccuPort is an extraction, transformation, and loading utility. The AccuPort utility also accompanies ACUITY Complete Care, and quite simply, this is how we move data into and out of ACUITY in bulk. Common data imports include member demographics, member eligibility, provider panels. Common extracts include an authorization extract, so that utilization management work done in ACUITY is automatically fed to a claims system. Finally, you'll notice the purple logo for AccuCare. These are optional diagnosis-specific care planning content programs that are fully integrated with the standardized care planning functionality found in the ACUITY system. We feature AccuCare programs for asthma, diabetes, COPD, coronary artery disease, heart failure, and high-risk pregnancy. Next, we wanted to take a few moments to talk about a couple of topics that are key importance when you're considering cloud-hosted solutions. First, the hosting center. TCS Healthcare recognizes that health information must be protected and secure. To deliver that promise, we've worked hard to find a hosting center that has a reputation and a proven track record for security. Last year, I had the opportunity to visit our hosting partner at their secure data center in St. Louis. I'll just summarize it this way. The physical security was impressive. The data protection and redundancy was astounding, and the electronic firewalls and barriers, quite simply, these are the highest in the industry. The second important topic is security, and it goes hand in hand with the data hosting. I'm sure we are all aware of the many PHI security breaches that are being reported so frequently these days. At TCS, along with our hosting partner, we have to take the security of your patient data very seriously. ACUITY Complete Care is HIPAA and high-tech compliant. And to date, we've passed some of the toughest security audits for clients in the United States. Information security requires frequent updates to the software and our procedures. And the security officer for TCS constantly works to update the security controls we have in place for all of our systems. Okay. So now let's go ahead and move to the ACUITY Complete Care platform and demonstrate some of that software functionality. Okay, I've brought up on the screen now ACUITY Complete Care. For those of you that may be familiar with the ACUITY platform, I do want to advise you ACUITY Complete Care and ACUITY Advanced Care are the same core systems. You are looking at version 7.20 of the core ACUITY software. Okay, so let's see here. One of the most prominent features on the screen now is my work list. We're going to focus on that primarily during our demonstration. As you can see, my work list includes work items that are due today, those that are due tomorrow, work items that might be past due, and those items that, for whatever reason, do not include a due date. Work items can include a variety of different record types. Linda's slowly moving her cursor around to demonstrate for you that some of these items could be tasks, interventions, assessments, appointments, or enrollments. And each of these represent a different type of work, and all of these link back to the main member records. And as we proceed with our demonstration today, we'll look at records again in greater detail. So we'll be coming back to these. I want to ask you to remember that the ACUITY work items can end up on my work list through a variety of both manual and automated ways. Some examples of ways that items could be assigned to me manually include, most obviously, work that I could assign to myself. I was working with a patient yesterday, and I gave myself a follow-up task for today. Another common example of manually assigned work items might be if there is a triage person taking incoming calls and referrals, and then using ACUITY to manually assign follow-up to the team members. Oftentimes, manual work items are assigned when working in a collaborative team or a dyad relationship. For example, the nurse assigns work to her social worker partner, and the social worker assigns work back to her nurse partner. But let's consider some of the automated ways that work items can end up on my work list. Recall in the suite overview when I described that red logo AccuStrat, the stratification and automation utility, and its ability to find patients needing outreach and automatically creating follow-up items in ACUITY. Thus, these items would be one example of an automated way that work items could end up on my work list. Finally, when conducting work in ACUITY, one of the field properties we can set up when we configure the system is to trigger the creation of follow-up work items. And in fact, Linda and I will demonstrate some of those triggers as we go through a workflow demonstration a bit later today. Okay. Now let's turn our attention to the left side of the screen. Here you'll see what we refer to as the left navigation bar. This powerful tool allows users to access many different views or browsers within the application. For example, Linda is clicking now on Members. Note that in ACUITY, patients or beneficiaries are all referred to as members. Once Linda clicks on Members, she sees a list of all of the members within the ACUITY platform that a role-based skill allows her to access. Since this would obviously be a very large list, Linda is able to search by member ID to quickly find the right member. So in this case, she might type or paste the member ID into the search term. And she's doing that now. And notice she's able to immediately find member Timmy Dawson and his member record. And as you might imagine, if she were to double click on his member record, it would open that. And we'll do that in just a few moments. We know that case managers would oftentimes rather search for their patients by name. So ACUITY Complete Care allows users to search for members by many parameters. So in the case where she wants to find patient Timmy Dawson, she can search by last name to locate members with the last name Dawson. Now, while in the example here there may only be 10 members, imagine if there'd been several hundred with that last name. So ACUITY Complete Care allows Linda to also apply a secondary search by first name. And now, notice she's found that record she was looking for, Timmy Dawson. So the member browse can do much more than simply find an individual member. Let's say, for example, Linda needs to find all of the members who have Robert Pennyman as their PCP. Now notice when she first opened the member browse, it opened to what we describe as the quick view. This means the parameters that were available for searching were limited to the member ID, last name, first name, date of birth, and social security number. But notice that full radio button next to the quick. If Linda selects full, we're going to see many, many more fields that are available now for searching. And in this case, she will again use the green search bar, click on physician name, and when she searches for Robert Pennyman, we see all of the members that have Robert Pennyman listed as their PCP in ACUITY. Again, what we've demonstrated here is the member browse and the ability to use quick search or the full search to see any number of parameters and filter or search to identify specific or groups of patients. Okay, to further explore the left navigation bar, let's look now at the care enrollments. In ACUITY, care enrollments represent case management cases. And so care enrollments are the documentation module that have care planning functionality built right into the system. So notice, once Linda has selected care enrollments in that left navigation bar, she sees all of the case management cases in ACUITY. She has that same search functionality that available in care enrollment browse that we saw in the member browse. But we want to show you now how the quick filters work. So if Linda wants to see only the cases that are assigned to her, she can select the quick filter Mine. And in the browse now, she sees all of the cases that are assigned to her. From here, as with the member records we saw in the member browse, she can double click to open and begin to view or update any of these records. And again, we'll come back to that in just a few moments. As you can see, there are a number of browses or views that are available in that left navigation bar. In addition to the members and care enrollments, which we just explored, you'll note authorizations, tasks, care plans, and others. And Linda could click on any one of these to see all of the items within that category, and then apply either quick filters or the green bar search in order to identify individual records or the population. But knowing that not all users of ACUITY Complete Care will have the same work, and not all people like to organize their work the same way, the users are able to customize the browse options in the left navigation bar. Notice that Linda has opened the menu to show or hide options. and she sees now the many browsers that are available. And she's simply going to add medical review to her option of browsers. And so if medical review is something that Linda needed to work with quite frequently, she would likely choose to add this to her left navigation browsers. Okay, now let's dive just a little bit deeper. We're going to go look at the member records. To demonstrate the member records, let's return to the members in that left navigation bar. And now we're going to search out Michael O'Donoghue. So she's reset the search. She's clicked the last name. In this case, she's simply typing the first 3 letters of Mr. O'Donoghue's name. She identifies 2 records for Mr. O'Donoghue. It appears as if he was active and termed. And she'll double click on that active line to open and view Mr. O'Donoghue's member record. So let's take just a moment to orient you. Notice this open to his demographics. And as you can imagine, this is where we'll see his name, date of birth, addresses, telephone numbers, allergies, languages, employment, and many other demographic data elements. And as a reminder, this information was most likely loaded by a bulk membership demographic or eligibility load that occurred automatically and on a scheduled basis via the utility that accompanies ACUITY, ACUPORT. Now, while we have Mr. O'Donoghue's member record open, we can also view his eligibility. Notice this tells us his primary coverage is active, and we can see that he's enrolled in a Medicare Advantage plan. We can see his PCP as Sam Spade, and we can see that he's assigned to this Medicare Advantage provider network. But note that this is record 1 of 2. When we looked at the member profile, we did see also a terminated eligibility. And now we're able to very quickly scroll to and view that eligibility. So see that this was secondary coverage that is termed. This was Mr. O'Donoghue's commercial coverage that was provided via his employer. And so we're able to see coverage really through a 4-way lens: primary versus secondary and active versus term. And what we're demonstrating here for you is that ACUITY is able to know that this Michael O'Donoghue covered by the Medicare plan is the same Michael O'Donoghue that used to be covered by the commercial plan. He has the same person ID, even though he may have different member IDs. In fact, we often describe ACUITY as being patient-centric. By this we mean that all records are associated around the individual patient or member or person and easily accessible via that centralized member records. And as we've already demonstrated, you can attach different eligibility periods to that same person. Here we can find and view and update, if needed, his authorization and care management records. Now, notice when, so notice to the right of the member tab, the authorizations and care enrollments. And again, here's where we'll find and view those clinical records. So Linda's now clicking on the authorization tab. When she does that, notice that the options in that left navigation bar have changed. These now reflect the options that would be unique to authorizations, such as pre-cert, or diagnosis and procedure, or inpatient review, outpatient review, and also where we could document and update appeals. But in the drop-down, Linda is going to see each of the authorization records associated with Mr. O'Donoghue. She can select any of these records to review or update those records. And she's going to select that inpatient hospitalization for Mr. O'Donoghue from March of this year. Okay, now I'd like you to turn your attention to the documentation bar on the far right-hand side. This is where Linda can view or add individual records that are associated with the authorization record. Notice that she can view links that are associated with the case, tasks, the record history, notes, assessments, reports and letters, phone calls, file attachments, emails, collaborators, medical reviews, and criteria reviews. Again, each of these are records that can be added to and updated associated with this authorization record. But now Linda's going to open the note that is associated with this particular case. It's 1 of 1, but she's going to go up and she's going to click on that blue command bar, and now we're able to see this note 1 of 1. But notice she's clicking on the drop down to see view. And what we're demonstrating here for you is that notes, in this case, this note is associated with this authorization. And she could see all notes that are associated with the authorization. But she could go beyond that and she could see all of the notes that are associated within Mr. O'Donoghue's coverage, or all of the notes that are associated with Mr. O'Donoghue as a member or person. The point here is that the documentation records that we see in that right-hand documentation pane can be associated at the authorization or care enrollment level, at the member coverage level, or all the way up at the member level. Again, demonstrating for you some of that patient or person-centric nature of ACUITY. Okay, Linda is now going to close this note. And this brings us back to the authorization record. We're going to explore authorization records, again, just a little bit more when we come back to them in our workflow demonstration here in just a few moments. Before we go on to that, though, let's take a look at the care enrollments. So as a reminder, care enrollments represent case management cases. And so notice first that the blue left navigation pane has once again shifted, and these are items that we would expect to be associated with a case management case as opposed to the authorizations. Linda's going to click on the care plan grid. And so what we're seeing now is a care plan that was generated for Mr. O'Donoghue. This was based on a diabetes assessment. The care plan grid represents the care planning functionality that's built within the ACUITY platform. Several days ago, I completed a diabetes assessment for Mr. O'Donoghue, and it generated a standardized care plan that I was able to individualize. And notice it follows that standard care planning or that case management functionality that you would expect. Assessments to identify problems associated with goals, supported by interventions, and driving ultimately to outcomes. And Linda is able to, quote unquote, work the care plan from this care plan grid simply by clicking on any one of the items. And notice she's clicked on the intervention, assess for normal fasting plasma glucose level. And in the documentation screen below, she's able to update these individual records. So now I need to ask Linda to go ahead and access one of Mr. O'Donoghue's case management cases, though, his care enrollments, by clicking on the drop-down. And notice he has two case management cases. There was a diabetes case that was open and closed earlier this year, but she'll click on the open complex case management case for Mr. O'Donoghue. And she's able to see that he is enrolled in a case management program that is specific for case management, complex case management. His priority is high. The current status is open. This is oftentimes described as the face sheet for the case management case. And again, there are specific case management care planning functionality items found in the left navigation bar. And again, we saw the care plan grid. We could see care plans, problems, goals, interventions, outcomes associated with Mr. O'Donoghue's care plan. And in the right-hand documentation pane, we see again those same documentation records that we saw with the authorization, but in this case, they're linked with this care enrollment as opposed to that authorization. Okay, now let's move one step further and actually demonstrate a workflow. And Linda and I have set up a couple of custom workflows to demonstrate a very simplistic fashion for our demonstration today. So Linda's going to close Mr. O'Donoghue's member record, and she's going to return to my work list. Okay, so we're going to focus on the work items that are due today. And again, notice the different record types. There is a task for an HRA that needs to be completed. There is an inpatient service that says an inpatient review is due today for Mr. Belushi. There is a care enrollment, a case management case that is newly assigned to Linda, and the instructions are to call the PCP about update to the plan of care. There is an inpatient service for patient Eddie Murphy with an inpatient review due. And then there is an assessment that needs to be completed for patient Denitra Vance with a readmission risk screening. So what in this scenario now, Linda is a utilization management nurse, and she's going to work on the inpatient service for patient John Belushi to see that an inpatient review is due. Mr. Belushi was admitted to the hospital on Monday of this week for pneumonia and initially had 2 days approved. Today, Linda has received updated review from the hospital, and she's going to document this in the inpatient review screen for Mr. Belushi and the authorization. Unfortunately for Mr. Belushi, his pneumonia has not improved, and in fact, it's exacerbated his underlying COPD, and his overall poor renal function is complicating an electrolyte imbalance. So Linda will update the clinical record first by opening the task, and she's now gone to the inpatient review screen. And in this particular case, she's simply going to add a free text note to document the updated clinical information. She clicks New. She changes the note type. She can add a contact. It's automatically assigned the note to Linda. And then she's going to, in the detail screen, simply copy and paste information that she's already copied to her clipboard. And we can see some of the clinical information that was received from the hospital today, showing Mr. Belushi's overall general poor clinical status. She can save this note record now. She'll close this note. And now she's going to add the new inpatient review to approve the 2 additional days beyond the 2 days that were already approved. We've taken the liberty of pre-filling some of these data screens, or data fields. I want to pause for just a moment and remind you that ACUITY is a highly configurable platform. The data fields that you're seeing can be managed using field properties, and fields can be pre-populated, they can be computed, they can be made mandatory. Oftentimes, our clients will say, for instance, we don't need to track the unit cost or total cost. Would you hide those data fields from the screen? So again, I just kind of wanted to remind you of the configurable nature of ACUITY. But again, Linda has added the 2 days that are approved, that are requested and approved. She's going to change the decision to approved. That's for this line item of these 2 days. It's going to update the last covered date to the 14th, adding the 2 days to the 2 days that were already approved. And in this case, we've configured it so that the next review will be due the day after the last covered date. And in fact, if we were to come back into Linda's ACUITY on Friday, she would have an updated task reminding her that the review is due on that particular day. Linda's now going to save this record and close Mr. Belushi's member record. And if she didn't check it as complete when she was in, she can check that particular task as complete now, and it will remove her from her work list. And the screen refreshes, and now she has 4 tasks due today. Okay, next we wanted to demonstrate for you some simplified functionality and workflow using the care enrollments. So in this particular case, what we've done is we've imagined a scenario where patient Denitra Vance was admitted to the hospital. And due to some inpatient screening, the utilization management nurse has identified that there's a possibility or probability that Denitra Vance is high risk for readmission. Or we've simply said that all patients need to be screened for readmission, and the UM nurse populated a field within the authorization record for the expected discharge date, and then based on triggers has assigned this pre-screening assessment to Linda to complete the readmission risk screening. And so Linda will now double-click on that work item, and it opens to the assessment. Linda can review the assessment questions if she needs to refresh herself. I want to take just a moment. I want to emphasize for you all that this is not a standard acuity assessment. Form number 49, readmission risk screening, is a very simplified readmission risk assessment form that Linda and I custom created in the Acuity system. So A, it is not a standard assessment, and B, this is not a validated readmission risk tool. It is a rudimentary tool that we designed simply to illustrate some of the functionality. But before Linda goes on and completes this assessment, she needs to gather a little bit more information. So she's going to go up to the command bar and she's going to click on Open Enrollment. What this does is it switches her over to the care enrollment. Here she can see the face sheet of that case management case. You notice that Mrs. Vance was enrolled in a readmission reduction program. The priority was tied as low, and the current status is an identified status. Once Linda completes her assessment, she'll come back and update that priority and status, and she may update other information here as well. But in order to gather additional clinical information about Mrs. Vance, she's going to click on the Authorization tab. She's going to click on the drop-down to see what authorizations exist for Mrs. Vance, and she sees one inpatient authorization. Currently, Mrs. Vance is in the hospital. She was admitted on the 28th, and Linda can scroll down. She can identify diagnosis code. She can see the facility, the admitting physician. She can see that right now, Mrs. Vance has been approved for 17 days. So in fact, this answers a couple of questions that were in that readmission risk screening assessment. Once she's ready now, she's going to go up to what we sometimes call the breadcrumb trail. She's going to easily go right back into that assessment. Now, in a real-world scenario, Linda might speak to other clinical staff that have worked with Mrs. Vance. She might call Mrs. Vance. There's a number of ways that she might gather the data elements. But she's going to go through and she's going to simply complete this assessment. Is the member currently hospitalized for a stay lasting greater than 7 days? The answer to that question is yes. In our, she'll put it in edit mode.
Thank you. There we go.
Again, in our hypothetical scenario, Linda actually called and spoke with Mrs. Vance, and she's learned that Mrs. Vance does not have limited social support. She lives with a spouse who's healthy and capable. She's learned that despite this prolonged illness, Mrs. Vance is ambulating independently, albeit with a front wheel walker, but she does not have impaired physical mobility per the definition. But in review of the clinical record, Linda learned that Mrs. Vance is on more than 3 medications, and she has, in fact, had prescription changes during the hospitalization. And remember, when she reviewed that inpatient authorization, she saw that there were no records indicating that Mrs. Vance has other hospitalizations in the past 6 months, so she'll answer this question, no. So as a reminder, very rudimentary assessment, simply created to demonstrate some of the workflow functionality within ACUITY. This is not standard assessment within ACUITY, but what's going to happen now is when Linda clicks Save, we've built triggers into the system such that when she answered the questions the way that she did, it's going to suggest that Linda do some follow-up tasks. And what it's telling Linda is that she's going to be assigned a task to schedule a follow-up physician appointment within 2 days of the anticipated discharge. And in fact, that's going to trigger for today. And when Linda clicks yes, we'll be looking at the assessment. Now, we could have configured that trigger to immediately take her to the task. We chose not to do that, but there's a number of different options. We wanted to give Linda the ability to decide, I'm done with this assessment record, close this record, and now she's going to click on that care enrollment for Mrs. Vance. She's going to change the priority to medium.
Sorry. There we go.
She's going to change the status to open because based on her conversation with Mrs. Vance and some other algorithms that are hypothetical, Mrs. Vance is going to need follow-up. And so the complexity here, though, will be low, and the severity will be stable. Okay. Now, the next thing that she's going to do is she'll save this record. She could put in some pretext notes, but Linda's going to assign herself a new task. And so in addition to the task to schedule the physician appointment, Linda at this point will click on Tasks and New. She's going to assign herself a task to call Mrs. Vance after the physician appointment to verify if any additional follow-up is required. Again, we have a hypothetical readmission reduction program with a hypothetical workflow and just wanting to demonstrate some of the functionality of the ACUITY platform. Linda will now save this task. And in real world, Linda would have changed that next review date to the date after the physician appointment. We maybe got a little out of sequence here. She doesn't know the date of the physician appointment. But we're done with this. We're going to close this record. And in fact, we're done looking at Mrs. Vance's member record, so we're going to close this record. And now notice there are some new tasks on Linda's work item for today. So there is the task to call Mrs. Vance after her physician appointment for follow-up. But that was the task that Linda just manually created a few moments ago. But notice the task to ensure transportation and escort to the physician appointment. And then 2 clicks below that, there is the schedule follow-up appointment within 2 days of the anticipated discharge. So we showed you the prompt that advised Linda that that task was going to be created. We purposely did not show you a prompt that would show that there is also a task in conjunction with that physician appointment to ensure with Mrs. Vance that she has transportation and an escort to the physician appointment. So again, our intent here was to demonstrate a variety of different options that could be in that particular workflow. If Linda had just completed scheduling that appointment, she could either open the task to do additional documentation or simply click the task as complete here in her work list. Yeah, here in her work list to mark it as done. Again, I want to emphasize these were simplified tasks. We could have added complexity. We could have made these quote-unquote simpler. Okay, we've returned to where we started with my work list, and now we're going to go ahead and open this up for questions and answers. Jessica's been collecting, oh, I'm sorry, my apologies, I've gotten out of sequence. Before we go to questions and answers, I did want to give Linda an opportunity to talk about implementation. Thank you, Linda.
Great, thanks, Jeff. So just a few words about the implementation process for ACUITY Complete Care. There's actually 5 phases of implementation for our hosted clients. The implementation assessment is an overarching assessment of business needs in order to recommend the best configuration for ACUITY Complete Care to meet your requirements. This is done by an RN with managed care expertise. Next, the TCS team will apply the necessary configuration changes as identified in the implementation assessment to your ACUITY environment. Third, your staff will conduct the user acceptance testing phase. This is done to ensure that the configuration meets the workflow decisions that were identified during the implementation assessment. Four, end user training is a joint effort involving TCS experts and the members of your team that have provided super user expertise during the previous stages of the implementation. Finally, a go-live date arrives and TCS provides enhanced support during the first several days of go-live to ensure that your team is successful. Your ACUITY Complete Care implementation also includes a dedicated and experienced project manager to assure that the implementation progresses and achieves your goals. We also wanted to emphasize that ACUITY Complete Care implementation includes reports and letters. TCS will work with you to develop customized reports and letters, which would then be available for you from within the ACUITY Complete Care system via one click.
Okay. Thank you, Linda.
You're welcome.
Now we'll go ahead and see if any questions have come in that Jessica can share with us.
Perfect. Thank you, Jeff and Linda, so much for such an informative presentation. Remember, attendees, if your question is not answered during the live session, a member of the TCS team will be in touch via email over the next few days with a response. We've had a couple really great questions come in. Jeff, the first I'm going to send your way. How do you ensure a secure connection to ACUITY?
Great question. Thank you, Jessica. So we use the Citrix receiver to create a secure VPN connection to the hosting data center. I suspect many of you are familiar with Citrix. I've used that a number of times for secure VPN connections.
All right, great. And what hardware and software are required to run ACUITY Complete Care?
Thank you. We do have a detailed requirements sheet that I'm happy to share with those of you who have interest. At a high level, quite simply, you need a Windows 7 workstation with Internet Explorer and connection to the Internet. Okay,
great. And Jeff, I think you touched on this earlier, but just to confirm, ACUITY Complete Care, is it HIPAA and high-tech compliant?
Yes, it is. In fact, again, we've passed security risk audits for some of the largest and strictest healthcare organizations in the United States, and we're very pleased with that.
Wonderful. Linda, how many users is ACUITY Complete Care designated to support?
That's a great question. ACUITY Complete Care was designed to support between 5 and 30 users, so it's more of a mid-range product for us.
Okay, great. And how long does it usually take to implement?
Depending on the size and the complexity of the client, an implementation should range between 3 to 6 months.
All right, great. Thank you. Actually going to double check and see if there are any additional questions coming in. Not seeing, yes, here we go. Will care plans and assessments be added by member age?
It could be with ACUITY.
Yeah, sorry, not exactly sure that. So what Linda was just alluding to is AccuStrat can be configured to filter on member age. Care plans, the care planning content that we provide via AccuCare is not sensitive to age, but that's by design. While they are diagnosis specific, they are not that specific. That said, care planning content can be customized. Either the care planning content provided via our AccuCare programs, or clients oftentimes have their own care planning content that they work collaboratively with TCS to develop in the ACUITY Complete Care environment. So hopefully that answers that question.
Wonderful. Thank you so much. Well, at this point, I think it's about time to wrap up today's webinar presentation. Jeff and Linda, thank you again for so many great, insightful facts about ACUITY Complete Care. And attendees, thank you for joining us and for all of the wonderful questions. Remember, if your question was not answered during the webinar session, a member of the TCS team will be in touch with a response. Please note that the recording from today's session will be available by the end of the week. To locate the recording, visit tcshealthcare.com/webinars. And also keep in mind that the recordings from the March and April presentations are also available at that location. Again, this was only a brief demonstration intended to review some of the newest features of the ACUITY system. For a complete demonstration of the full capabilities of this comprehensive care management solution, please be sure to ask for follow-up contact. Again, this concludes our webinar presentation for the day. Thank you so much, and we hope to hear from you.